Sheriff Reese, would you like to start?
Thank you very much. And I want to thank all of you for joining us today. We're here to provide an update on the outbreak at Inverness Jail. And before we go into the details of the current status, it's important to understand the context of our jail system and situational awareness of the steps that have been taken to date in response to COVID-19. I want to say we care deeply about the safety and welfare of the adults in our custody. We have a legal and moral obligation to care for them and the staff who provide the rehabilitative and medical services in our facilities. In February of 2020, a year ago, MCSO and our public health partners began developing processes and protocols to prepare for the coronavirus. We tested those protocols in tabletop exercises for various scenarios that we may encounter both in the law enforcement and corrections setting. Corrections is incredibly challenging and complex in a pandemic because they contain congregate areas where many people share spaces in an enclosed area. At MCSO, we have two facilities, MCDC, which has single cell housing and shared common areas, and our largest facility, Inverness Jail, which is primarily dormitory style housing where all of the spaces are common areas. In February of 2020, our jails were at maximum capacity with approximately 1,100 adults in custody. The Sheriff's Office and Corrections Health implemented all of the public health recommendations immediately starting in March of 2020. As we learned more about the viruses and as the world did, we implemented new recommended guidelines from public health, the Oregon Health Authority, the CDC, and work requirements set by OSHA. We continue to work with our health partners to identify new risks and make improvements. You can visit our website for a complete list of the changes we've made. We had criminal justice system partners who worked with us quickly to reduce the number of adults in custody by over 30% in just a few months. Because of these measures and the efforts to keep the jail population low, we were successful in keeping the coronavirus out of our jail population until December of 2020. Our first adult in custody tested positive that month at MCDC. We worked with our health partners to quarantine and isolate people at risk, approximately 11 months since the virus first was recorded in the US. In late December, we saw a significant increase in the number of positive cases at Inverness Jail. The amount reached the threshold of an outbreak, and we remain in this status. Dr. Vines and Dr. Seale will provide additional details on the outbreak. In this outbreak at Inverness, approximately 145 adults in custody have tested positive for coronavirus. On February 2nd, the Multnomah County Sheriff's Office, Corrections Health, and public health officials began vaccinating adults in custody. 108 individuals consented to taking the vaccine. Vaccination efforts resume today. We expect to inoculate another 100 adults, which will be more than a third of the jail population at Inverness. I advocated for the county to vaccinate those in custody because, like other congregate residential settings being prioritized, the staffing, spacing, and underlying health conditions of residents in correction settings greatly increases the risk of transmission. I'm grateful to Chair Kafori and public health officials for making this vaccination a priority. So today, 2 dorms remain in isolation status. Individuals housed in these dorms have tested positive for COVID-19. 5 dorms remain in quarantine status. Individuals in these dorms were exposed to a positive case but have tested negative for COVID-19. Dr. Seale will provide additional details regarding the frequency of the testing process for these individuals. This week, the Sheriff's Office has worked with our criminal justice system partners to further reduce the jail population during this outbreak. The following steps are going to be taken over the next few days. Working with the presiding judge and the district attorney, we formalized our criteria for who can be booked into jail. Over the past year, we've asked police agencies to cite in lieu of custody on property crime offenses and misdemeanor crimes. This practice will now be codified in a new presiding judge's order. We're working with the Department of Community Justice to release additional individuals currently being held on sanctions for parole and probation violations, and to limit the use of jail sanctions for the next few weeks. Director Erica Pruitt from DCJ will provide additional details on that effort. Our partners at the U.S. Marshals Service have agreed to move approximately 20 people who we are now holding for federal court matters to another facility. These steps will give us and our health partners additional housing options and create more physical distancing space to reduce the risk of exposure to additional individuals. And finally, I want to acknowledge the hard work and sacrifice by the men and women who provide for the safety and health of everyone in our jail facilities. While many professions have switched to teleworking options during the pandemic, our employees continue their essential in-person work. They've risked their personal safety and the health of their families in service to this community. They deserve the community's thanks for a job well done during these tumultuous times. Thank you.
Director Pruitt.
Thank you, Sheriff Reese. I ground myself by, first of all, talking about the vision of the Department of Community Justice. Our vision is community safety through positive change. And the safety of the community and the justice-involved individuals that we serve is of utmost importance to us. And we are committed to working in partnership with the Sheriff's Office to release those who are eligible in order to alleviate pressure on the jail and to create space for distancing during this challenging time. We're also committed to working with our community partners and with Corrections Health to make sure that those who are eligible release are connected to the needed resources. This is a challenging time for all of us, and the only way we will get through this is through working together. Thank you.
Dr. Jennifer Vines. Thank you, Erica.
Thanks, Julian. Good morning, everyone. Thanks for being here. I'm sorry it's because of such a large outbreak at our jail. I just wanted to briefly look at this through a public health lens and offer some context about how this outbreak compares with others. I have to say, with over a decade of experience working as a health officer and responding to many different types of outbreaks in many settings, I can't imagine a more complex mix of factors, including a virus that spreads really easily, a setting with serious space constraints and staffing constraints, and then similarly, an environment that's disciplinary, where there's understandably low levels of trust among adults in custody and those charged with their care. So we are working hard along with the sheriff and deputies at Inverness Jail. We've had communicable disease investigations teams on site. I have been deeply involved in responding to this outbreak. And I will say we have combed Centers for Disease Control guidance. We've consulted with Oregon Health Authority. We've done our own internal informal reviews, and we are doing everything we can to slow and hopefully stop the spread of the virus at Inverness Jail. Thank you.
Thank you, Dr. Vines. I'm going to ask Dr. Mike Seale, the Medical Director of Corrections Health, to go ahead. Dr. Seale.
Good morning, everyone. I'm Dr. Mike Seale, Director of Corrections Health. I'd kind of like to start by giving appreciation for the support and coordination we've had with public health partners, Dr. Vines and the Sheriff's Office. We have regular ongoing meetings, and we also have ad hoc communication as new cases develop. And this has really helped guide our process, giving the evolving knowledge of COVID and the resources we have to combat COVID. So I thought I'd give you an understanding of what we've been doing in Corrections Health, and hopefully again give you some context of the activities that we're performing on a day-to-day basis. We have staff on site 24/7 in both adult facilities to find symptoms, limit exposure, and make sure that people have access to the care that they need. Some of the efforts to meet those ends would include screening before booking. So as people enter the booking facility, they are screened for both symptoms of COVID and temperature. We also screen individuals again before they come into housing. So after the booking process, as they're being admitted into the jail facility, our nurses perform a medical mental health screening routinely, and we have added screening for COVID specifically. So both signs and symptoms, temperature, and questions regarding any contact with known exposure of COVID. We're also performing daily screenings, both symptoms and temperature, for all individuals new to incarceration for the first 14 days of incarceration, to attempt to identify anyone who came into the facility and was developing COVID. We also are performing daily symptom screening for individuals at higher risk for developing complications should they get COVID. And that would include people over the age of 60, those with diabetes, heart disease, pulmonary disease, cancer, or have immunocompromised. And that screening is performed throughout their incarceration on a daily basis. We, in a jail setting, have always had a respiratory disease outbreak process. We've implemented this in the past and refined it over previous years for influenza. And it includes a variety of factors: heightened awareness with regular communications to staff so they know what's happening in the facility, heightened regular screening, as I've just described, identifying people who are ill in the jail population and removing them from the general population to limit spread. Performing testing is available. We've had increasing availability of rapid antigen tests, which allow us to get a rapid result while on site without having to send a specimen to a lab. We cohort housing based on results, and by cohorting, I mean clustering people who have like conditions. So in the example of COVID, those who have a positive test result for COVID and their symptoms don't require a higher level of medical observation, they can be housed together. Similarly, those who have been exposed to COVID and have negative COVID tests can be housed together as we continue our daily screening and serial testing that I'll talk about in just a minute. And then for those who have significant symptoms or have significant underlying conditions which require a higher level of monitoring, we have 2 units in the jail facilities, a total of 20 beds that are negative airflow respiratory isolation beds. These are monitored by nurses on a 24/7 basis, and our providers round on those units on a daily basis. We've been performing also employee screening for corrections health employees. Each employee affirms prior to the beginning of their shift that they have not had symptoms in the past 24 hours. They've not had contact with a known COVID case within 14 days, and they also check and document their temperature. We've been providing education throughout the pandemic for the adults in custody in a variety of languages using CDC posters. We have medical translation services available for those that need it. And we've been providing vaccine-specific information recently, distributed both in person, by personal visits by nurses and epidemiologists to our units at Inverness, and also on the monitors at Inverness, where we post all sorts of medical and general correctional information that runs on a nearly continuous basis. One thing I'd like to emphasize is that given the general stressors of the pandemic, the new issues that are involved with quarantines and repeated testing and vaccination, that we continue to be really aware of the need for enhanced mental health support. The health department has been a good partner in providing resources that Corrections Health can use to link people and their families to mental health services, because we're all aware this is a very difficult time for the people in custody, their families, and the staff involved. As of yesterday, we had, as the sheriff mentioned, 5 housing units that are composed of people who are COVID negative by test but have been potentially exposed. And that totaled 139 individuals, and another 94 individuals who are in isolation who have been tested positive for COVID and are housed now in 2 housing units. One of the things I'd like to emphasize is that almost all of the people that we've identified with COVID during the outbreak have been asymptomatic or have had very mild symptoms. For those that have more moderate or severe symptoms, we use our negative airflow medical housing units, as I mentioned, and we've had to hospitalize 1 individual who had underlying health conditions who has subsequently returned to the jail setting. And to give some general perspective, we've performed in 2021 approximately 900 COVID tests, and we've identified the 145 positive individuals at Inverness related to the outbreak. In all of 2020, we had conducted 194 tests for COVID and identified 22 positive cases. We have had dorms on quarantine at Inverness during the outbreak that have been released from quarantine. We released one dorm from quarantine on the 8th of February, which was a COVID exposed dorm, but negative by test. And we released another dorm yesterday, which was COVID positive by test. We've had no deaths, fortunately, due to COVID. As the sheriff mentioned, vaccinations are underway. It was first performed on February the 2nd. 108 individuals were vaccinated on that day. The team is again on site today, and the hope would be to vaccinate over 100 individuals who have already expressed interest in the vaccine. We should have additional future opportunities to vaccinate the individuals at Inverness. We have a list of individuals with risk factors for complications. So as vaccine becomes increasingly available, we have a plan to utilize that. And once the vaccinations at Inverness are complete, our plans are to move to the detention center downtown and continue our vaccinations there. So with that, I'll thank you for your participation today and happy to answer any questions.
Thank you, Dr. Seale. I'm going to ask all of our presenters to come back on to their videos, and including Chief Deputy Alexander, who is here to help us answer any operational questions from corrections. I'm going to go ahead and ask reporters if you can quickly put your name in the chat so we can see the order which you want to, so we can take things in sort of an orderly fashion. Everybody should be able to unmute. And I'm going to remind everybody that if you got on late or you wished you had recorded and weren't able to, Kate and I are both recording. We'll be able to send you the recording and we'll post it later on YouTube. Cale Williams from the Oregonian, please go ahead.
Hi there, thanks for taking my question. We received some reports from inmates and defense lawyers that one of the problems was that some of the people in custody feel like they're punished when they are either showing symptoms or receive a positive test. I know that one of the CDC guidelines was that correction staff are not supposed to use the punitive areas of the jail, solitary confinement, the hole, et cetera, as isolation areas, but we received some reports that that was happening in Inverness, and I was hoping that somebody could either confirm or deny that and offer some comment one way or the other.
I'm happy to answer that question, and thank you for asking that. It's, I think, important to understand the dorms at Inverness Jail all look approximately the same. They have different sizes that they'll hold different amounts of people, but they're all configured approximately the same. And we move people from an open dorm setting to a quarantine or an isolation dorm based upon whether or not they've tested positive or whether or not they've been exposed. But those dorms all approximate each other, and the housing situations are very similar. And I don't know if Dr. Seale wants to add to that, any of the folks who have been medically isolated in the negative pressure cells.
Yes, Sheriff, I can answer that as well. So typically when we have a large open dorm and we identify an individual who has symptoms, which would be the most common finding that we have, that individual is removed from that area and tested by our nursing staff. And then based on the test result, obviously it leads to a quarantine or other measures. That individual is sometimes isolated in a sense in our negative airflow area, our medical observation unit. Oftentimes we do that if, for example, they have symptoms overnight and we need to put them in a safe place, minimize any potential exposure, and then perform the testing the next morning. And then dependent on those results, that individual may be moved back to a COVID positive cohort dorm, if that makes sense, which could be another large open dorm, but is only containing individuals who have tested positive for COVID. So that would be the one use of using an individual cell. But again, for the purpose of isolation, we would put the dorm in quarantine pending the test results so that people aren't moved in or moved out, and hopefully, again, limiting exposure.
Thanks, Kale. Alex Zielinski from the Portland Mercury.
Yeah, thank you. I understand the outbreak at Inverness has made it hard for people being held pre-trial to attend scheduled hearings, as judges understandably don't want to potentially bring positive cases into their chambers. But at the same time, this delay leaves people forced to remain in a congregate setting during a COVID outbreak without really a path out, possibly risking their health and their life. I'm curious, why not make it possible for adults in custody to call in via video or audio to these trials or these hearings? I understand people who are out on bail are allowed to do this. Can someone address this issue?
Alex, thank you. This is Mike Reese, and that's a great question. As the pandemic hit, a lot of processes in the community and in the criminal justice system shut down, including the court system. And it's been really challenging to work through that with arraignment processes being delayed, as well as, as people become COVID positive, of course, we don't want to transport them into the courtroom. We do have limited facilities at Inverness that allow for video arraignment and video court matters. It is, we've talked to the provider of those services to add capacity, and I believe we've added 2 kiosks that allow for enhanced court processes, but it's not nearly enough. It simply is the structure of the facility, the limited space for court matters. We're doing everything we can, though, to work with the court to facilitate that. And when we are able to transport people who are not COVID positive, we do so. Additionally, one of the things that's happened recently, we met with Judge Waller a couple weeks ago and worked out a process so that people who were being released to other treatment resources, whether it's mental health or substance use disorder treatment, that we could do through Corrections Health test to determine that they were not COVID positive, because many of those facilities and treatment folks do not accept people who are haven't been tested and or COVID positive. So we're able to facilitate that with the court and hopefully start moving more people out of custody to better situations.
Conrad Wilson from OPB.
Hi. So a quick question: is this the same outbreak that began back in December, or is this that we're talking about now, or is this a different outbreak? And also, the 145, I believe, cases you said that a positive test from last week, is that a current number, or is that a global outbreak number if we're looking from kind of the number that began back in December?
Dr. Brides, I don't know if you want to take that.
Thanks. Yes, I'm just quickly looking through my notes for the start date for this particular outbreak. This actually, yeah, the outbreak that we're talking about now has a start date of December 5th.
And that start date, that might be a little confusing to people because we've been talking about this. This is Julie as a January outbreak. There were some, the adults in custody cases started later at the very end of December going into early January. So we
correct. And I can unpack that a little bit. So there's a very low threshold for an outbreak definition in a congregate setting, typically just two cases. And so that December 5th start date would have been when cases first appeared. An outbreak is not considered over until you've gone 28 days, which is 2 quarantine periods without a case. So additional cases trickled in, and we never hit that 28-day mark before the rapid increase in January among adults in custody.
So is there a total number for number of cases connected with the Inverness Jail starting with December 5th?
I think we're up to 149. I'm looking at Dr.
You cut out there a little bit. 149, you said?
Sorry. Yes, I believe we're at 149.
Yeah. If I can clarify, Conrad, are you asking for both adults in custody and staff?
Yeah, I had heard 145 number as of last week. I wasn't sure. I took that to mean that there were 145 adults in custody last week that had tested positive for COVID-19.
That was, so the 145 was the last number that public health had put on the debrief last night. Dr. Vines might have some additional information this morning.
Thank you. No, it's 145. I don't know how I got 149. It is 145 adults in custody as of
So 145 since the outbreak began back in December. Okay, got it. And then you said 100 have been vaccinated and another 100 will be vaccinated starting today. Is that correct?
Yeah, this is Mike Seale, correct. So it was 108 in the first vaccination and at least 100 people today is the goal.
Okay, and what's the jail population?
This is Sheriff Reese. It varies day to day as people come into custody or leave custody, but approximately 750 individuals are in custody. That number changes, it flexes, as do the actual people in custody. So we have new people being booked into custody every day, and we have people leaving our custody every day.
Got it. And just to, again, last clarifying question, we're just talking about the Inverness Jail. We're not talking about the facility, the maximum security facility downtown, correct?
Yes, that is correct.
Okay, thank you.
We're gonna go from Conrad Wilson to Nick Budnick at the Portland Tribune.
Hi, thank you very much for the opportunity to clarify and follow up on Conrad's question. 145 inmates, can you talk about how many non-inmates have been tested positive, including employees, family members, that sort of thing? And secondly, when we talk about 750 people, was that Inverness? Because earlier, Chris Lytle had said the census was 512 at Inverness. And then actually I have a related question, which is on the quarantine dorms, which is, but I guess that can wait.
So we believe that there are 24 staff who have tested positive at the sheriff's office. I don't know how many corrections health staff or DCJ staff have tested positive. Certainly we don't have complete numbers on family members and things of that nature. The population that I spoke to of about 750 is system-wide, so that includes both facilities. Right now we have about 525 people in custody at Inverness Jail.
Thank you.
And Nick, I could clarify a little bit because we are, and Sheriff Reese doesn't have so he got bad information from his communications person, Julie Sullivan over here, because I can clarify from the public health numbers that we are relying on to, as you can tell, there's a lot of moving parts. The best public health numbers come from the public health communicable disease team, and their latest numbers provided last night would be 145 adults in custody, 24 people total who are non-adults in custody, and that includes both corrections staff from the sheriff's office, whether that might include, we don't know if that also includes corrections health, but so everybody associated with Inverness Jail who is not an adult in custody. There were 24 total cases, and that includes corrections or corrections health staff as well as household contacts. Because of the way that the Oregon Health Authority deems outbreaks, it's any case connected by space or time. So there are 24 others associated with this outbreak in particular. So just wanted to clarify that. And of course, Sheriff Reese would not have had that depth of information. I just wanted to clarify.
Well, thank you both. Thank you both very much. And if it's okay, I'd like to ask a quick follow-up question about the quarantine dorms. Did I understand you correctly that people who are thought to have been potentially exposed are put in dorms together? And I guess my question is that potentially, if I'm understanding that correctly, is that potentially fostering the spread of disease? Do you think that's sufficient, or do you think it's wise to look into other measures, such as what the Deputies Association has been pushing for, which is opening up those 96 cells at MCDC? And I apologize if you addressed this earlier. I was late.
It's Mike Seale. I can address how we manage the quarantine. The other questions may need to be directed elsewhere, but typically, as I said, what occurs is that someone will either identify themselves that they're having symptoms, or we identify them through our daily screening, or we identify them as a result of contact. But once someone is identified, that person is removed from the dorm. Once they're COVID positive by test result, we address that person differently. The people remaining in that dorm then are quarantined, and so no movement into the dorm, no movement out of the dorm. The nurses begin screening on a daily basis for symptoms, temperature, elevated temperature, and identify anyone who may have new symptoms. In addition to that, we perform an initial round of testing. So everyone in the dorm would receive a rapid antigen test. And again, based on the results of the test, we would sort out those individuals who are COVID positive, those who may be COVID negative. And then the testing is repeated in 5 to 7 days. So we do another round of testing, have the exact same process, remove those who might be COVID positive. And then a third round of testing is performed in another 5 to 7 days. In an ideal world, all of those second and third round of tests are negative and no one has any symptoms. And then we consult with public health on guidance about releasing the quarantine from that dorm. If there are positive tests, then the clock sort of resets and we do another round of testing and continue to monitor individuals. So I hope that helps you understand at least the basic quarantine process.
Yes, thank you. I appreciate it. And it'd be great if
happy to answer the other question, Nick, in relation to MCDC. So we've had a long planned electronics upgrade of that facility. It's been in planning, procurement, and onboarding of contractors for many years. The facility there was built in 1983. So you can imagine the electronic systems in that building are antiquated and have had serious failures leading to safety issues for both the staff and the adults in custody. We're going floor by floor, remodeling that facility, upgrading those electronic systems so that they're current and provide for enhanced safety and security for the staff and the adults in custody. There's also more accountability because we're adding camera systems to MCDC that give us a better lens on what's occurring. And one of the first situations we had with COVID positive adults in custody, it occurred at MCDC in a newly remodeled floor. And we were able to use those camera systems to quickly identify the adult in custody and all of the people that that person had come in contact with to isolate and quarantine them appropriately so that we could keep that facility safe. We're always assessing our housing options and have looked at this with our partners at facility management. Again, it is a a project that is necessary to keep from having a catastrophic breakdown of the electronics. They're cobbling together parts now to, when we have failures, to make the system work, but they don't know that they can do that forever. And if we did have a serious failure of that system and had to move people out of it, we have very limited housing options elsewhere. Additionally, the 96 beds at MCDC are not nearly enough to cover all of the people at Inverness Jail. We would still have people living in congregate settings and dormitory settings at Inverness, irrespective of the situation at MCDC. Thank you.
Thank you.
Thanks. There, we have a question from Jamie Ding at the Oregonian.
Hi, thank you everyone for taking the time to speak with us today. My question is, what is the protocol for when an inmate refuses a COVID test? I spoke with a recently released adult in custody who was under the impression that people who refuse COVID tests were placed in the same category or same cohort or dorm as people who tested negative. I'd like some clarification on that. Thank you.
This is Mike Seale. Our perspective with that is, as is true of all medical interventions in a correctional setting, is that the adult in custody has the right to decline any and all interventions. In the case of someone in a COVID dorm, we're monitoring each and every person who's been in an exposure dorm, I should say. We monitor each and every person daily for signs and symptoms. And we do the repetitive rounds of testing and a lot of education about the need to have repetitive testing. So at this point, we've elected for individuals who have no symptoms but decline to have the test to keep them in their original housing area and then continue to offer the repetitive testing as we would to the rest of the individuals in that housing unit.
Thanks, Jamie. Alex has, from the Mercury, has one more question, and then we'll probably take one or two more after that, and we'll wrap up.
Thank you. Yeah, I just kind of wanted to get some clarification about some anecdotes I've received from adults in custody who are in dorm 11 on Sunday in Inverness before and during what amounted to a riot. I've heard that when after inmates were able to block officers out of their offices for a short amount of time, inmates said that the officers then turned off the water and airflow in the dorm, which made it impossible for folks who had just been pepper sprayed to wash themselves off. I'm curious if there's any validity to that and if there's any explanation as to why that might have happened.
So I'll start and then I'll let Chief Alexander add some context as well, because he was there that night and responded to the scene. On Sunday night at approximately 11:40 p.m., we had 3 adults in custody who refused to go to their bunk area. And 2 of those, after trying to convince them to follow the rules and bunk in for the night, correction deputy in charge of that dorm decided to remove those 3 individuals from the dorm. They were being disruptive and it was impacting the rest of the dorm. The 2 of the individuals cooperated and were escorted out of the dorm. The 3rd refused to leave the dorm and was placed in custody after a struggle. He fought against the efforts to control him. And while he was doing that, he was yelling and agitating other adults in custody in the dorm. The corrections deputies that responded remained calm and professional throughout. They had chairs, plastic chairs thrown at them as they escorted the person out. They left the dorm, and then we had our corrections CERT team respond to take the other adults in custody out of the dorm as we conducted an investigation into what had transpired. The entire event lasted about 2 minutes, and as long as it took for the deputies to take the person into custody and leave, that's the amount of time that the disturbance transpired. We had a couple deputies that had minor injuries. One was scratches during the struggle with the adult in custody, and another that was hit by one of the plastic chairs in the arm. that's kind of the extent of it. And I'll let Chief Alexander provide some additional details.
Sorry, just one thing. You didn't mention, you said officers were scratched and hit by chairs, but can you confirm that the man you're speaking about was also tased by officers?
He was, yep. That's what allowed them to control him and put handcuffs on him.
Yeah, and this is Chief Deputy Alexander. I'll take over from there, Sheriff. That night after the incident occurred, we escorted the deputies and the sergeant escorted the individual out. They then went back into what we call the indirect station, where the officers have indirect supervision over the dorm on our graveyard shift. They recognized that the tension was high in the dorm, and recognizing that, did not go back out into the dorm. And that's when the dorm kind of moved stuff around and blocked some entryway and put some tables in front of the officer's station. So that at that point is where they did not re-engage. They knew that the tensions were high in that dorm at that moment. So they would at that point keep monitoring the dorm, and then call for what is our CERT team, or Corrections Emergency Response Team. And they would come in, and then they responded. And as part of that response, when you talk about the things that you mentioned, the airflow was turned off, the water was turned off. Well, the airflow wasn't turned off, I'm sure of that. But as part of security response, you may see water get turned off because we don't want them to flood either the toilets or out of the sinks, or wet down the floors with water to make it slippery for responding personnel. So those things happen as part of a security response when we do these types of things. However, in this case, those things did not occur. And the individuals, when the CERT team arrived and made entry, and it took, I want to say, about 90 minutes for them to assemble. And then we took taking our time to develop that plan, the safe plan. As they made entry, everyone was on their bunks and waiting for us. And then we just escorted people down to processing. So there was no destruction or fighting against CERT or anything like that. It was literally, when we entered, they were all on their bunks waiting, and then we just moved them out. So that's where we were at.
Thanks, Alex. We have time for one more question, and then we'll wrap up. Hearing none, I appreciate very much everybody, Sheriff Reese, Director Pruitt, Dr. Vines, Dr. Seale, Chief Deputy Alexander, taking the time to do this. We will have a recording if you missed it. And thanks again, everybody. If you have follow-up questions, you can reach Chris and I via email, Chris Seale. And otherwise, thanks. And hopefully everybody wash your hands. Stay safe.